so that's the fundamental issue, is that we've got this metabolic milieu, this crisis of metabolic health. And it's, we start scratching our heads. Well, I wonder why there's such a rise in anxiety and depression and autism and ADHD. And, I think the idea is that these things are closely connected. This is even more challenging because even people who have a normal insulin level,
Hmm.
and you think, oh, well, this person's not insulin resistant. That doesn't mean that their brain is not insulin resistant. So this is another
Mm.
thing that's really important to understand, because organs become insulin resistant at different rates. And so someone could have a normal insulin, their normal hemoglobin A1C, and yet we know from good research that their brain could be insulin resistant. And brain insulin resistance is associated with all the major mental health issues: schizophrenia, depression, bipolar, Alzheimer's disease is all associated with brain insulin resistance.
All right, welcome to the show, Dr. Matthew Bernstein. It is an absolute pleasure to talk to you today about metabolic psychiatry. I'm very excited.
It's my pleasure to be here. Thanks for having me.
Oh, amazing. So I always start the podcast with your journey. So it's something that I feel that we connect really well to in terms of stories and what brought you to the point of where you're at now, and in such a huge paradigm shift of field. And it's incredible work that you're doing. And you've organized the first ever public conference in 2023 in metabolic psychiatry. And so what brought you to this very, very interesting field?
Yeah. Well, yeah, it is a bit of a journey for me, and definitely a bit of a personal story. So I'm glad you asked, because I
Mm.
agree. It's important for people to understand the context. So,
Oh,
I was a pretty traditionally trained psychiatrist, 4 years of medical school, 4 years of psychiatry residency. I worked on an inpatient psychiatry unit at McLean Hospital. It's part of Harvard, treating people with severe mental illness, which has always been sort of my passion. People with
mm,
schizophrenia, bipolar. I think we were able to help people quite a bit in those acute crises, but I was always concerned that we weren't really seeing people get full recovery from these conditions. We could get them out of the acute crisis, but then, people would get stuck on these big medication regimens and not really get back to their full level of functioning. And we would call it a success to say the person wasn't continuing to get hospitalized all the time, but they would still have symptoms. They wouldn't be able to work. They wouldn't be able to often even live independently or have relationships. And, that really didn't feel like a success.
yeah.
Um, I then was pretty influenced by the work of Robert Whitaker. He wrote this book called Anatomy of an Epidemic,
Hmm.
about, sort of critical of the way psychiatry is done. And I was really pretty impressed by the rigor of that research. So I was
Hmm.
already pretty skeptical of sort of what I was doing. And then we had this very intense personal situation where two of our children, we have three kids, all
Hmm.
boys, and two of them at ages 12 and 14 came down with very acute onset, out of the blue, very severe depression,
Mm.
OCD, and physical symptoms all at once.
Wow.
And, they went from being happy, well-adjusted kids to not even being able to go to school, being suicidal, like really, really severe symptoms,
Mm.
unable to read, even though they were avid readers beforehand, their brains weren't working.
Oh my goodness.
And the traditional paths that we knew about looked very psychiatric. We were taking them to good psychiatric clinicians and therapists, and they were getting not only no benefit from that, it was actually making them worse. So that
Mm.
was a really, difficult reckoning for myself and my wife, who's a psychologist. And we really started looking outside of mainstream medicine for solutions, sort of found our way to functional medicine, eventually figured out that they had autoimmune encephalitis due to tick-borne illness, mold exposure, other toxins. And it was a huge journey of trying to figure out how to get them better. And during the
Yeah.
course of that, I was learning all this functional medicine, and my mind was just blown because I realized that my traditional training was just scratching the surface of what's going on in the body.
Yeah.
And through that process, I also got exposed to the work about the ketogenic diet in epilepsy and saw that it was now being applied in serious mental health conditions as well,
Mm.
and that people were having these amazing turnaround stories, people who had been decades of psychosis, even taking the strongest antipsychotic medications, their illness was going away completely from being in a ketogenic state for 3 to 6 months, which is,
Yeah.
when I first heard about that, I was in a lecture hall at McLean Hospital at Harvard, and I think there were probably 200 people in the room, and I think I was the only one that actually believed what the lecturer was saying.
I can imagine. I can imagine.
They were all
Yeah,
just like, "Oh
right.
yeah,
Nutrition
great."
doesn't fix this.
Exactly. Yeah. And it would have been probably my response had I not already had the experience that I had with my kids. Sometimes it
Yeah,
does take, your own, something big to sort of shake things up. Um,
absolutely.
anyway,
Absolutely.
that sort of began my, when my kids started getting better, I had enough time and resources to devote to figuring out what I wanted to do with this information. And I think for the people that I work with, I really think that of all the interventions that I learned about in all of functional medicine, this is the most powerful one for the brain, for severe mental health issues. It's
Yeah.
incredibly powerful, and it's not that hard. It doesn't require, going to 6 different independent labs and taking, 20 different supplements. Some of these, protocols that we come up with are really effective, but they can be hard to follow, and takes a lot of executive functioning to follow these protocols. Whereas this is, people need to eat 3 times a day or 2 or 3 times a day anyway. If we
Hmm.
just make the food such that they're going to be in a ketogenic state, and otherwise, whole foods, and there's more to it than that, that we can have an enormous benefit on these very severe mental health conditions. And that's exactly what I've been seeing now for, about 4 or 5 years since I've been doing this in my practice.
Hmm.
I'm just absolutely blown away by how powerful it is.
Incredible. I can't wait to dive into all the detail on you with this, on
Yeah.
that with you.
Yeah.
But I, I must say, like the most incredible stories and the most incredible, thought leaders and movement makers are the ones that come with stories like you with your own family or your own health or your own children's struggles, and it really does. We sort of land in that place, don't we, to be taught these things to make the changes, and it's very hard to go through, and it's so incredibly heartbreaking to see. I've got 2 kids myself, and it's the parents' worst nightmare to have something like these things come to and happen to your children. You wish it would happen to yourself. But to be able to remedy and support and research and come out stronger at the end is just such an incredible thing. So, yeah, I really empathize with you. It's a really hard thing to go through. Yeah.
Thank you. Yeah.
So I want to first define before we dive into ketogenesis and how you've been using this in your practice and indications and how you see this, but how the term metabolic psychiatry. So
Yes.
explain this because I want to make sure that everyone starts to hear this more because the more
Right.
reading I did on what you've been doing and what I'm seeing is I couldn't be more on board with this, and I think we need to spread this wide and far.
Yeah, absolutely.
Yeah.
Well, yeah, I mean, I think it really highlights this fundamental bidirectional connection between metabolic health and brain health,
Hmm.
that those are so closely connected, so intertwined, they're almost the same thing.
Hmm.
That the way one's brain functions is almost a direct result of one's metabolic health. And there's a lot of reasons for that. One is that the brain is the most energy intensive organ in the body. Metabolism is a lot about making energy. It's not just that, it's other things too. It's about making building blocks and getting rid of waste and all of these various reactions. But a big part of it is about making energy.
Hmm.
And the brain is about 2% of the weight of the body. And it's at any one point using 20 to 25% of the body's energy.
Yeah, wow.
And so when there's an energy problem in the body, it's going to be reflected in how the brain functions for sure.
Mm. Mm.
And you compound that with this rampant, almost epidemic of insulin resistance that we have based on the way we've been told to eat by our governments for the last, 50 or 60 years, to eat, 50% of our calories from carbohydrates, and 10% of our calories can be from simple sugar. And of course, people are eating a lot more than that in terms of the sugar. you know, huge percentages of our population have insulin resistance or prediabetes or diabetes.
Mm.
It's the majority of people in the US meet
Mm.
criteria for one,
Mm.
one of those three conditions, and they're just a continuum essentially.
Yeah.
And so it's not a coincidence that we're also having a mental health crisis because these things are so connected.
Yeah.
Um, and
Absolutely.
there's actually, so there's data showing these bidirectional connections. If you have diabetes or cardiovascular disease or obesity, you're much more likely to end up with a mental health diagnosis. If you have
Hmm.
a mental health diagnosis, you're much more likely to end up with diabetes or metabolic syndrome or obesity. We know that in adults, we see that, but that's really correlation.
Hmm.
Um, it's not necessarily causation. There's some hints of causation in the literature, though. There's this really interesting study where they looked at kids and followed their metabolic health until they got to be young adults.
Hmm.
And they saw in the kids who had the highest insulin levels at age 9, there was a threefold increased risk in psychotic disorders like schizophrenia in their 20s. And
Right.
so we can see that you start off with the metabolic health issue, bad, very severe mental health problem later. Same
Hmm.
thing with the kids who gain the most weight during puberty, fivefold increased risk of depression, major
Yeah.
depressive disorder. So
Yeah.
yeah, this is really concerning. And, because our metabolic health is getting worse and worse every year. It's not something that's, sort of stagnant. It's like, it's absolutely exploding.
Yes.
Um, just
Yeah.
one other statistic, the rate of diabetes in the US is for type 2 diabetes, it's around 11 or 12% now, which
Phew.
is of adults. It's an enormous number. And unfortunately, quite a few kids too, but that's the
Yeah.
number for adults. In 1960, it was 1%.
Wow. That is
So, I mean, we're just, we're
disastrous.
completely different metabolic creatures, organisms than when we were, just, you know, uh, decades ago. Um,
Absolutely.
this is,
My goodness.
yeah.
And kids, in my practice, my naturopathic practice, I'm seeing at scary levels as well. I've just done a thesis on eating behaviors and dietic responses with parents and in infants mainly, but it
Mhm.
starts then, and it even starts in the mother. We have
Yes.
metabolic conditions through in pregnancy, and then we obviously have tendencies through with children and then feeding patterns. So it starts with the parents, but the rise in insulin levels that I see in children, because I measure insulin levels in
Yeah.
all my kids because I need to know now, because after a few cases where we've missed things and haven't even measured for celiac disease and inflammation disorders, it's scary. I never ever saw 10 years ago in practice kids with high insulin levels.
Yeah.
Absolutely blows me
It's amazing.
away.
It's
Yeah.
amazing. Yeah. And it's, so that's the fundamental issue is that we've got this metabolic milieu, this crisis of metabolic health. And it's, we start scratching our heads. Well, I wonder why there's such a rise in anxiety and depression and autism and ADHD. And, I think the idea is that these things are closely connected. And, even this is even more challenging because even people who have a normal insulin level,
Hmm.
and you think, oh, well, this person's not insulin resistant. That doesn't mean that their brain is not insulin resistant. So this is another
Mm.
thing that's really important to understand because organs become insulin resistant at different rates. And so someone could have a normal insulin, their normal hemoglobin A1C, and yet we know from good research that their brain could be insulin resistant. And brain insulin resistance is associated with all the major mental health issues, schizophrenia, depression, bipolar, Alzheimer's disease is all associated with brain insulin resistance. And
Mm.
so we can still get benefits even with people who look like they don't have an insulin resistance problem. We can still get benefits with this intervention with those
Mm.
people. And I've seen that now multiple times where normal looking blood work, but the ketogenic diet is still incredibly powerful. And it doesn't just work through, bypassing insulin resistance. We can get into the mechanisms later if you want. But there's
Mm.
other mechanisms as well that, through which this diet works. And so it's not, it's a big part of the story, this insulin resistance, but it's not the only mechanism. Yeah.
Yeah. All right. I think that's a good segue actually, because let's sort of set the scene in terms of mechanisms.
Yeah.
And we talk about primary fuel, and I have this sort of argument with people all the time. Well, primary fuel is glucose in the brain, so why do you need? And so but that I think explaining that sort of mechanisms around how this works, and I think that would be a great lead in, and even testing and markers. We do a lot of metabolite testing here at SNH, and in my own practice as well. And so, any insight into how you look and without going straight into protocols, but even if
Yeah.
you can tie in some of that with the mechanisms.
Sure, sure. Yeah, so in terms of mechanisms, the one we've been talking about so far, we'll start there. So
Mm,
the brain, largely does run on glucose. People are not wrong about that. And even in a deep ketogenic state, the brain still uses glucose. It's never
hmm
going to stop doing that. So, but what we are providing though, when the brain is insulin resistant, it could have glucose literally bathing these neurons, but the glucose can't get into the neurons for use as fuel because of that insulin resistance blockade. And ketones bypass that blockade. They don't need insulin to get into neurons to be used for fuel. So we're providing this additional source of fuel when the neuron is having an energetic crisis, which is happening right on a regular basis for most people. And that's manifesting as these mental health symptoms. But we're bypassing that energetic crisis with the ketones. They're this great additional source of fuel.
hmm
And what that does is it reduces oxidative stress because when the brain cells, when the neurons are starving for fuel, they're creating a lot of oxidative stress
hmm
and inflammation. So we're going to reduce oxidative stress, reduce inflammation, um, and provide this additional source of fuel. So that's all a very important mechanism. But the
mm,
other really big important mechanism is that ketones are a signaling molecule as well as being a fuel molecule.
yeah.
And they signal to the mitochondria to go through mitochondrial biogenesis to split and make more of themselves. Um, and it causes the mitochondria to do more mitophagy or, essentially recycling of mitochondria, the old non-functioning mitochondria and making new, better functioning ones.
Mm,
And, mitochondria are super important, as
hmm
not just
Yeah.
for producing energy, but now, in the last, 10, 15 years, we've seen an explosion of research of all the other things that the mitochondria do,
Mm,
besides just make energy. And, so when you have these healthier, better functioning and more numerous mitochondria, everything's going to work better. And the brain can literally heal from all of these insults that have been happening over the years by giving that signal to the mitochondria. We
yeah.
literally see the brain heal right in front of our eyes. It's absolutely astounding.
Yeah, it really is. It really is. And obviously I'm preaching to the choir here, but it's I've seen it. Even I've had clients this year, two clients with Guillain-Barré syndrome, and the incredible change in diet with the recovery that they were doing was just astounding. And then that combination with some other therapies that we use in clinic, like hyperbaric, oh my gosh, you
Yeah.
just elevating that healing process so much. But the diet is, it's so astounding how the ketogenic model can work across so many different fields as well.
Right. Yeah.
Mm,
Yeah. And of course, it started in epilepsy. And I just want to back up that claim about healing a little bit because there's
mm,
actually really good data in epilepsy that proves that this diet can heal the brain. So I just want to go into that for a second. Uh,
absolutely.
so, the ketogenic diet's been used in epilepsy for over 100 years. It was invented to treat epilepsy in the Mayo Clinic in 1921. There
hmm
were some precursor versions of it even 100 years before that for diabetes. And there's probably some version of it that was used by Hippocrates in ancient Greece where they were, starving people of carbohydrates and really, fasting people to generate ketones and solve seizures. So anyway, we've had this strong data for epilepsy in kids, and it works even when the medications don't work. So that's been shown in randomized controlled trials. There's two Cochrane reviews that validate that it's a treatment that is effective even when medications are not effective.
Mm,
But what they've also seen in a few different studies now that they've published is that these kids who have a really good response to the ketogenic diet for their epilepsy, they can be on the diet for a few years, come off all their medications, get their seizures under control. After a few years of being on the diet, they can come off of the diet and the seizures never return,
huh.
which means we've healed the problem.
Yeah.
We have very few things in medicine in general that truly heal, especially the brain. The brain is,
Absolutely.
often was used to be considered, not having the ability to generate new neurons. We can't generate new brain cells. We all know that that's not true anymore, but we
Hmm.
still think of it as one of the organs that's the hardest to heal of them all.
Yeah.
But this diet actually, there's real data showing that it heals an analogous, brain condition, epilepsy,
Mm,
which is astounding.
mm.
Um, and now we're seeing all of these, case reports and pilot trials in mental health, and just, literally thousands of stories of people who are turning their lives around, using this intervention.
Yeah, it's absolutely incredible. I'm going in so many different directions in my mind as you're saying this, but there's so many connections with brain. And when we think about mood and we think about gut and we think about all these things, and the ketogenic diet is helping support all of those energy systems
Right.
because of the inflammation, because of the insulin, because of the it's regulating those systems. So, like you say, it's one of these therapies that we can use that is changing function. And so, a lot
Right.
of these medications that we use, they are really merely just band-aiding function.
That's right.
It's yeah, it's very cool, very, very cool.
Yeah.
So diving into more around or outside of the mechanisms now
Yeah.
into indications, and therefore looking at how you measure this. So how are you using continuous keto monitors? Are you using in terms of just the diet? Are you using supplementation as well? And then how do you know that they are at that right level? So is there specific things that you would do prior to seeing clients or starting them on the ketogenic diet? So maybe let's just talk through some of those steps.
Sure. Yeah. I do a whole lab panel looking at
Hmm.
metabolic status and nutritional status, to before we start, just to give us a baseline.
Yeah.
There's usually nothing on that panel that would rule someone out from doing this.
Okay.
And really, there's no mental health condition pretty much where I wouldn't want to try this if someone wants to do it.
Mm,
It works in all of the mental health conditions that it's been studied in so far.
okay.
And so it's not like I can say, well, it works in bipolar, but it doesn't work in schizophrenia, or it works in depression, but it doesn't work in OCD. It works in all of them.
Hmm.
Including, there's even data that it works in anorexia, which is another
I was
one
going
that
to ask you
people,
about eating disorders, actually. Yeah, that was
yeah,
my next question.
it's great for binge eating disorder. And people were a little scared to apply it in anorexia, but there was initially a case report, and actually know the people who were involved in that. Essentially, someone who has been through anorexia treatment for, 15 years, never really got better.
Hmm.
And a family member who was a physician suggested the ketogenic diet, and they found someone to implement it. And this person had an amazing response, and then actually was still having a little bit of food noise even after the ketogenic diet, and ended up doing a couple of ketamine sessions, and it all completely went away. And this person's now been in complete remission for at least 5 years now. And then they did a case series of another 5 women with weight restored anorexia, and had also a tremendous response. Now there's 2 large trials going on at University of California, San Diego, where they're studying
Wow.
the ketogenic diet in young women with anorexia.
Mm,
And there's a whole basic science component. The investigator has a theory that people put themselves into an anorexic state partly to get into a ketogenic state. They can become addicted to kind of being in ketosis. Because when you're, starving yourself, you're in ketosis, and it's actually treating a fundamental underlying anxiety that they have. And so that's part of the behavioral addiction to starving oneself for some of these young women, is that they don't realize it, but they're putting themselves into ketosis. And so the idea is, let's make a regimented rule of a plan where you can feel that just that way, but you don't need to starve yourself. And and it's really effective, it seems.
wow.
So
That
so
innate and lead into reducing food, even when we're unwell, in any
yeah,
term.
right.
It's pushing us into that ketogenic state to then have more function in the mitochondria. It's
That's right.
incredible to signal. It makes
Yeah, it
sense.
is. Yeah, I
Yeah,
mean, it's evolutionarily preserved signal.
exactly. Exactly.
And of course, we evolve going in and out of ketosis. That's another thing that, it's important to say,
Yeah.
that it's not like that we invented this in the modern world, or even in ancient Greece. You know,
Mm.
millions of years ago, our, evolutionary forebears were absolutely going in and out of ketosis all the time because there
Yeah.
wasn't a steady supply of food. And ketones are a survival molecule. They're what allowed people, this allowed us to be here now. If there
Hmm.
weren't ketones, we never would have made it
Yeah.
because they essentially allow the brain to function really well when there's no food. In fact, the brain functions better when there's no food, when the brain's in a ketotic state. And so it ensured survival when there was no food for a few days. People didn't get hangry and tired and, discouraged. They were had ketones on board and they said, we're going to figure out how to solve this problem. And they had the
Hmm.
brain power to solve that problem.
Yeah.
Um, so
Yeah. I
it,
love that. I love that metabolic flexibility term. Just I
yeah,
explain it to my clients in that way because I get a lot of clients who are insulin resistant and
yeah,
they are shaky and hangry and have all these symptoms in between meals. And I had clients that are actually fearful of not of having breaks between eating because they know how bad they can feel.
that's right.
And giving them the power back to be able to actually feel comfortable when they don't eat and have that fasting state and feel still clear. I know now my body is very good at metabolic flexibility. So I'm actually better if I can be in a ketonic state when I can be talking and speaking and with clients, I'm much more clearer. But seeing and showing clients how that feels is very empowering for them. They are blown away how they can be so clear with no food. Mm,
I agree 100%. And I had that same experience myself. I
mm,
was definitely, before I learned about all this, I was eating, trying to be healthy, but I would eat a lot of fruit and I was definitely insulin resistant. I had to eat 5 or 6 times a day to be able to keep my brain going. And then, I went through a period where I said, decided to do this, lowered my carbohydrates, but I also did some fasting, became metabolically flexible, and it is not just empowering, it's liberating. I mean,
yeah.
you feel trapped. I used to have to take snacks with me everywhere I
Yeah.
went because I knew I might need one, to be able to function. And now I feel like, well, I'm walking around with all the fuel I need. I don't have to worry about that anymore. It's a very liberating feeling. Yeah.
It is, yeah. I've been trailing and hiking in the flat irons here in Colorado, and I can leave and just like not have breakfast and walk out on an hour and a half hike, and I know I'll be fine. I have
Yeah,
great amounts of energy, and that
that's
for
right.
me is like I can live my life and I can be metabolically flexible, and I don't have to worry about when my next meal's going to come.
That's right. Right.
Yeah. So what I know you said that there's no conditions as such that will exclude a ketogenic diet, but is there any that you can think of that you would maybe go in a different direction first or not
Sure.
go ketogenic?
Yeah,
Yeah.
yeah, yeah, absolutely. Yeah, I don't want to overstate it. I mean, if someone is in the midst of an acute psychiatric crisis,
Mm.
we probably wouldn't say, let's do a ketogenic diet right now.
Yeah,
If someone is acutely psychotic and, behaviorally out of control, they can't, first of all, make the decision to do this kind of big
of
intervention at that
course.
moment and probably can't follow it. So, an acute medical or psychiatric crisis definitely would be something we wouldn't do. If someone's really underweight from their anorexia, I think most people are not bold enough to do that. Although I did just speak with some dietitians over the weekend. I was speaking at a conference with dietitians, and
Mm,
they were telling me that they do sometimes, if someone is at the end with anorexia and have a feeding tube, there are sometimes now people who are saying, well, this is our chance. Let's do the ketogenic diet as a last ditch effort. And sometimes it's helpful
mm,
because, anorexia is the most fatal of all the psychiatric conditions, actually.
yeah,
Um,
yeah. So sad.
so there, and there's a few others. There's a couple medications that we can't combine the ketogenic diet with. There's one class of diabetes medications, the SGLT2 inhibitors. Um, a few other things where there's relative concern, but we still could forge ahead.
Mm,
But generally, in terms of like which psychiatric diagnosis,
hmm.
we really can use it in almost any of them. There's probably the most data on bipolar disorder, though. So that's, one where it really seems to shine the
Hmm.
most.
Hmm.
But we're seeing incredible benefits in actually these chronic psychotic disorders as well, for which
Yeah.
there's really no good treatments. The antipsychotics sometimes reduce symptoms, but they have so many side effects, and they often don't take away the symptoms either. So it's frequently people are coming to me, they're on two or three antipsychotic medications at once, plus some mood stabilizers, and there's so many side effects, and they're
Hmm.
still having all the symptoms.
Hmm. Yeah, I see
And
this too.
yeah, and so, with those folks, it's really a great intervention because we can get their energy back. We can start the process of lowering these medications and hopefully getting them off many of them. And people get their energy back, they get their thinking and their cognition back. And then often, if people are able to stick with it, those psychotic symptoms start going away as well.
Mm.
And sometimes they go completely away on the ketogenic diet, which is just amazing. These people, again, just like epilepsy, where the medications didn't work, this intervention can work.
Yeah.
Um,
And
yeah,
it's so accessible. And this is why I love talking about this. I was talking about to a colleague yesterday because I've interviewed many people who are in the research space of treatment-resistant depression and body dysmorphia. And, we talk about ketamine a lot. We talk about psilocybin a lot, but they're very quite inaccessible treatments because of the
right.
cost, because of the accessibility of country, regulations, things like that, and training, having good centers. But a ketogenic diet can be followed by anyone and can be accessed by anyone as long as you're doing it in a way that is suitable for you and you have some, guidance in that way. It's for anyone, and that's why I feel like this is so powerful as well. Powerful treatment.
I agree 100%. I mean, we're putting the power back in the individual's hands that,
Mm,
you know, this is not, I mean, of course, it's really helpful and really important to get some guidance from a practitioner or clinician who understands how to do this so that
of
you can do
course.
it right.
Mm,
It's easy for people to say, "Oh, I tried a ketogenic diet, it wasn't for me," and you found out, they tried it for a week or two and they probably weren't in ketosis.
yeah.
So it is really important to work with someone who can educate you or really figure out how to educate yourself. But once that education process occurs, yeah, this person now has complete control over their health,
Mm,
as opposed to needing a clinician to prescribe them something and do a test and do a procedure. I mean, talk about, really helping the grassroots from a grassroots level. I mean, this is food and it's,
yeah. It's the
done
basics. It's not the
just
shiny things.
yeah, done
Mm.
just the right way. It really is the most powerful treatment.
Yeah. So in when you're seeing clients as patients, and are you seeing any specific compliance issues, or difficulties in the beginning? And are you having to use exogenous ketones? Are you having to do, yeah. So is there certain parameters that you see that are commonality among treating patients?
Yeah. Well, I mean, first of all, we have to get someone interested. That's
Mm,
the art of it in some ways is, I'm talking about something that they've, what? It's same response as the clinicians. Our whole culture has the same response. Are you kidding me? This is just food. How could it possibly do something that, all of these, expensive medications and doctors who've done, decades of training can't, do for me? How could it possibly, the solution be in food? So there's a
mm,
lot of convincing and education that has to happen at first. And what we often do see actually very common is that families will learn about this and be
mhm.
very convinced. They'll learn all about it, and then they'll be trying very hard to convince their family member to do this. And
Yeah.
often they are able to convince their family member. And then, of course, it's not the easiest thing to give up these addictive foods. People come in. We have a center, a program where people come in and stay with us. And that
Okay.
makes it a lot easier. I
Mm,
also do this with outpatients who are doing this at home.
mhm,
And, to do it on your own at home, even with a lot of advice and help, is a little more challenging. It definitely can be done.
mhm.
But, for people who have a harder time with their executive functioning, they're having a lot of symptoms, they may be having a lot of side effects from the medications they're already on. This program really can be helpful because they come in, they see me, we have this, wonderful program director, social worker who does therapy with them. We have a dietitian right on site who's crafting the meal plan. And then we have a chef who's making delicious ketogenic
Wow.
food. And
That's really
so
cool.
that makes it a lot easier for people.
Yeah.
And we use a lot of technology. We use continuous glucose monitors. We don't have access to continuous ketone monitors. I can't wait until we can get them in the US, but we don't have them yet. But we do check blood ketone levels at least once a day.
Yeah.
We check body composition and follow that parameter, and then we follow their lab work. And we're also measuring their, mental health rating scales and functional rating scales. And, the results we're getting are absolutely amazing. When people
Mm.
do the whole program, and we can talk a little more about what the whole program is, because it's not only food. There's more to it than that. A lot of adjunctive things that really go along with the diet that can really support it and make it even more powerful.
I absolutely would love to dive into that. But just to sort of have a completion around this, timing of these sorts of protocols. A lot of people ask me, oh, am I going to be on this forever? Or is it pulsed in and out? Is my cholesterol going to go through the roof?
Right.
Like all these simple things that people are worried about, right? And it's like, well, don't you want to get better? Like it's just,
Yeah. Yeah.
So what do you say to those sorts of things when you're asked?
Well, if they're using it for a more serious mental health condition, I tell them that we just don't know the answer to how long they need to do it.
Mm,
The research just, we don't have enough science about that yet for mental health. I
hmm.
do talk about the kids who, only need to do it for a few years with epilepsy, but I say, well, that's also a different disorder, and it's kids whose brains are a little more plastic than an adult.
Yeah.
And so I can't promise that they're going to be able to go off the diet and, after a few years and have retain all their benefits. But
Hmm.
it's possible. I do
Hmm.
know a couple of adults who've done it for a few years and come off and are able to retain their benefits. So
Mm,
I've seen it a few times. I just can't promise that. So what I say is, first you got to try it for 3 months and see if you're
hmm.
getting benefits. And
Yep.
usually people do, they're getting benefits and they want to keep going. Sometimes people say, well, how long? And I say, well, we just don't know. Now
Hmm.
that you're getting benefits, let's see how good you're going to feel, after a year of doing this.
Yep.
And we can keep lowering medication. Some we can get you off more medication. Um, let's just see how good this can get before we start
Hmm.
thinking about, the whole end of this story. It took probably many years to get to this situation. It's going to take some time to heal as well. We have to be patient, which again, in our culture, hard. We don't learn patience, and none of us practice it enough as we should, right? So, um,
Absolutely.
yeah, regarding the cholesterol issue, I have spent a lot of time educating myself about, what all this means. There's a few things you can say. Number one is that if you're starting off metabolically unhealthy and overweight, carrying extra weight, this is absolutely going to lower your 10-year cardiac risk,
Hmm.
being in a ketogenic state.
Hmm.
Even if your LDL cholesterol goes up a little bit, all the other parameters get better.
Hmm.
If you're starting off thin and somewhat fit and you're exercise and you do this, there is this subclass of people called lean mass hyperresponders
Hmm.
who have a very high LDL on a ketogenic diet, and they have a very high HDL as well, and extremely low triglycerides, very good low insulin. And there's a lot of research being done on those folks, and it looks like this does not confer cardiac risk, even with these super high LDLs. But
Mm,
that person would always have the option to take something to lower their LDL cholesterol, whether it be an herbal supplement or a medication if they wanted to. I
hmm.
generally would recommend not to, because I think, it's not necessary. But if someone was concerned and they were otherwise feeling good, we're not trapped at that point. We don't have to go off the diet. There's definitely options at that point. But there's also
Mm.
reassuring data that even with a very high LDL, if as long as those other parameters are in place and there's low inflammation, that we're not adding cardiac risk.
Yeah, I absolutely agree with you. I have many a client come to me with these concerns, and I do all the homocysteine, we do the folate, we do the B12, we do the metabolites for those as well, and we do the high sensitivity CRP, we do
Yeah,
as you say, insulin, and it's subsequent of that rise in the fats of the diet that is going to rise the LDL. But if everything else and genetics look good, we do a cardiac panel and it's all in the data, isn't it? So it's
right.
it's matching that, and it's a very interesting concept, like you said, these hyper responders. And we also know the data around needing to have cholesterol for,
That's right.
this is the whole premise of what we're talking about today for having good mental health and good, brain function.
That's right.
Mm,
Yeah,
mm,
yeah. I mean, cholesterol is essential for hormone synthesis and, membranes of all the brain cells, of course,
mm,
incredibly important
mm,
molecule. And, it's not to say that we can guarantee that, a high LDL with other factors is fine. It's not. I mean, there's
Mm.
definitely some concern about high LDL if you're not otherwise taking care of all the other parameters. But what I'm talking about is high LDL in isolation. And also we get this NMR fractionated cholesterol panel sometimes where we can see
Mm.
what type of LDL. And there's the
Mhm.
small, dense ones that are more dangerous. There's these large, fluffy ones. If they have the right pattern, that's another reassuring sign. And
Yeah.
finally, if someone really was worried still and they weren't sure if they wanted to go on a medication, we can always get a cardiac calcium score or even a
Mhm.
CT angiogram to
Yeah.
really see, is there any, that's the gold standard, not LDL measurements at all of heart
Yep.
disease. You know, the gold standard is looking at the vessels, which now is accessible with imaging and without invasive imaging. So, yeah.
Yeah, absolutely. No, I love that you comment on all of this. It's so good.
Yeah.
Yeah, I see in practice now actually, in all honesty, I'm more worried about two lower levels of cholesterol and people
Right.
on medications because I know to the detriment that is to the brain and the hormones. And so I see this swing now that I'm actually really concerned now. I see people with really low levels of cholesterol and it's worrying.
It's definitely worrying. There's definitely
Yeah.
data about cholesterol being too low, being
Mm.
associated with aggression, violence, and
Mm.
suicide.
Yeah, right.
Um,
Mm.
and so, it's not causal data, but there's definitely an association getting cholesterol too low, or sometimes it's naturally too low. I had one person in my practice many years ago before I knew about this. I wish I knew about this then, one of
Mm.
those
Mm.
situations, who naturally had extremely low cholesterol. Her total cholesterol was always below 100. Her LDL cholesterol was always below 50 with no medication to lower the cholesterol. It's just
Mm.
natural. And she had a
Mm.
very severe mental health condition. Um, and if I wish I knew, like I said, about this, I would have advised her to raise her
Go.
cholesterol, and it might have made a difference. Yeah,
Yeah, yeah, my goodness.
yeah,
All right, so let's jump into the program before we
yeah.
run out because I run out of time.
Sure.
I really want to
Yeah,
run through and get the complete contextual look at what other things that you use in conjunction with this. So
yeah.
yeah, let's step through that.
Sure. So, synergistic with the ketogenic diet absolutely is exercise.
Mm-hmm.
And so
Mm-hmm.
we get people moving their bodies, no matter where they're starting, we're going to, get them moving and increase their movement. So we get them in the gym, we get them doing some strength training.
Mm-hmm.
We have people walking after each meal and
Yeah.
out in the sunlight, which is also another part of the program
Mm-hmm.
is, morning sunlight throughout the day, multiple times throughout the day to
Mm.
entrain our circadian rhythms, which is so important. But also, light is a nutrient for the mitochondria as well. And
Yes.
so we're giving the mitochondria multiple signals there, from the diet, from the ketones, from the exercise, from light. And then finally, we give the mitochondria safety. And so everyone we try to convince to do a regular mind body practice, whether it's a
Mm-hmm.
breathing practice or a meditation practice, or some people like doing more movement based mind body practices. But there's so much good evidence now about mind body practices being not just good for mental health, but good for metabolic health.
Mm-hmm.
And, again, it's giving that safety signal to the mitochondria so that they can, take care of the cell and make the cell function. Yeah.
I love this, the cell danger response. And this is the
Yeah.
thing is that we just get these, hyper responders and there's never completion cycles here. So, and it's,
Right.
it's this psycho neuroimmunology that's
That's right.
spoken about so much now is that we're having these overarching threat systems that are always thinking that everything is out to get them. And I love that you use the term safety because I use this
Yes.
a lot too, because it really
Right.
explains that we need to have the body safe.
That's
Yeah.
right. Yeah, we see this all the time in the program. If someone is doing everything right, but
Mm,
they're not taking care of that part, that mind body piece, that safety piece,
yeah.
we'll see problems. And
Yeah.
so, like, for example, it's pretty frequent people will come up to us and say, what's going on? My continuous glucose monitor is telling me that my glucose is all the way up at 150, and I swear I didn't eat any carbohydrates or sugar. And, the first question we ask is, well, what's going on with your anxiety right now? And they say, oh,
Mm,
well, it's through the roof. I'm practically having a panic attack. I'm scared about this and this and this. And we say, okay, let's breathe. Let's do a breathing exercise. 5 minutes later, the glucose is down in the normal
mm,
range, down to 90.
mm.
It's an amazing demonstration and learning experience about this mind-body connection that just having anxiety, panic will cause your whole metabolic system to change. And just
Yeah.
calming down that anxiety getting to safety, and your metabolic health improves in 5 minutes.
Yeah.
Um, and
Yeah.
like when that happens, it's a great opportunity because people really get it. They're like, oh, okay, now I understand what you're talking about, how important
Yeah.
that part is, right? And it's very
Absolutely.
important. Yeah.
I saw this first happening myself when I was wearing a CGM, and I live near the ocean in Australia, and so I hopped into the ocean, and then I looked at my data at the end of the day, and the exact moment I walked into the ocean and went for a swim, my glucose dropped. Like
Mm,
there was nothing else, and it happened multiple times. I repeated the experiment. I'm like, wow, ocean work drops my glucose, and so
amazing.
other things like stress, work and everything, no food involved in that, and up goes my glucose. So
Right.
exact same mechanism. It's just incredible.
Yeah, absolutely.
Mm,
It's really
mm,
powerful. The other great thing about the CGM is we see people's, glucose hover on the low end as well when they're in a good ketotic state.
mm-hmm.
And people say, well, you know, isn't this a problem? Like, the alarm is going off. Then we shut the alarms off, of course. But
Yeah,
they say this is a problem. My glucose is, 53. Isn't this a problem? Do you feel okay? No, I feel great. I have all the energy I need. It was again another demonstration of, the energy is not just from glucose. You've got your energy now, working well from these other sources. You've got fatty acids and ketones fueling yourself. You don't need as much. Your body's saying, we don't need as much glucose right now. Your liver's not going to make as much and release as much. Great.
yeah.
This is again is a sign that everything is working as it should.
Mm-hmm. Mm-hmm. Absolutely. So we've gone through lifestyle, we've gone through diet, we've gone through education, talking through showing them how to make. So it's an incredible program that you've got there. Is there anything else in terms of supplementation or as I said, exogenous ketones or anything that you're actually using as a buffer or a supporting external influencer?
Yeah, well, we don't generally use exogenous ketones
Mm.
often. We do use MCT oil, which
Yeah.
is sort
Okay.
of a hybrid. It's not exogenous ketone. It's a fat molecule, medium chain triglyceride.
Mm.
Um, but it's a very ketogenic fat. And so it is a way to help people, especially in the early stages, who are not used to eating so much fat. If they can
Mm-hmm.
get a little MCT in a smoothie or in their coffee or some other way, then we can boost the ketones that way
Yeah.
without needing to eat quite as much fat. So that we do use that. And then supplementation is really based on the individual situation. So, if someone has, issues on their lab work that I can see, we will
Mm-hmm.
supplement based on that. I
Yeah.
do tend to see elevated homocysteine levels a lot. It's very common. And
Mm-hmm.
of course, the lab tells us this absurd number that it's okay to be up at, 13 or 14 or something. And, we want to see them much lower. Um, the other one that we test for is carnitine, very important test when
Mm.
you're doing ketogenic diets. It's an amino
Fatty
acid
acid.
that
Yeah.
allows the fatty acids to get through the inner mitochondrial membrane for
Mhm.
use as fuel. And if you run out
Mm.
of carnitine, you're going to run out of the ability to be in a good ketotic state. And so we check that in the beginning. We do check that at month one. Low carnitine is also associated with depression.
Yeah.
So that's an important one. And we do end up supplementing carnitine sometimes. And then there's
Mhm.
just some ones that a lot of people just benefit from. If someone's energy is kind of low, even though they're doing the right things, we might supplement with some creatine as
Mhm.
well, which give them some energy for workouts. And also, there's now some
Mm.
good data about it helping with mood and cognition and bone health. So, so creatine is a really good supplement too. But I try to be a little bit minimalist when it comes to supplements
Yeah.
because I know how hard it is for people to take. They're already taking all these medications. We're asking them to do all these lifestyle changes, and
Yeah.
so I only want to use the ones that are really important for that person. I thought of another one that's important that we do see a lot is low iron,
Mm.
which is really interesting because the lore is that you only see low iron in menstruating women or someone who has some kind of bleed, but low iron is rampant in the population that I see,
Mhm.
including young men.
Mhm.
And I could do a full panel with ferritin, and so even sometimes their iron is okay, but their storage is very low. And so sometimes we'll depends on the severity of it. Sometimes we'll see if the diet will fix that. Because it could be an absorption issue. I think I don't really know the reasons. I don't know the answer, but
Mm.
my
Mm.
hypothesis is that there's an absorption issue with the standard diet that people are eating.
Yeah.
but it could be, more than that with some people. And if it's really significant, we'll certainly supplement that as well.
Yeah. Yeah. I love iron mechanisms and biochemistry. So, because again, I have a client need and demand for it. I have so many women, children, men, athletes come in and they are so low in their storage. And so I dive deep into iron metabolism and it's really fascinating. It is more of this evolutionary perspective of inflammation and the hepcidin and the
Mm,
storage. And so I also see it in illness and sickness, obviously, the pulled back of the storage and the
right.
rise in hepcidin. So we actually have, if we have long-term chronic inflammation like your patients would,
Yeah.
then iron is always at an evolutionary point of protection. So it doesn't
Mhm.
actually want to be out into the bloodstream. So then,
Interesting.
pathogens can feed. So I
Right.
see over time that the body learns to actually have a lower storage or learns not to actually have that absorption rate. So
Uh,
yeah, it fascinates me because I was also at the same point going, what's going on with everyone?
right. Right.
These people aren't menstruating. Like, they don't have heavy bleeds. What's going on? So
Oh,
yeah, it's
thank
a
you for that.
fascinating thing. Yeah, and
Yeah.
then thyroid obviously has such an impact, and because
Yes.
it is such a key nutrient or mineral for
Yeah.
so many other markers and enzyme reactions and systems that yeah, it puts everything in a really bad state.
Yeah, yeah, and of course, iron. People think about it just as helping to make red blood cells, but we now know that it does so many other things. But especially, it's part of those electron transport chain proteins in the mitochondria. And
Yes.
so, if you don't have enough iron, your mitochondria can never function optimally.
No.
And so, this whole point of all of this we're doing here is to improve the mitochondria so they can then, help optimize our health and heal us. So we definitely need to get iron straightened
Mm,
out in order to
mm.
have that really work. Yeah.
Mm. I love seeing the patterns in clinical practice, like you said,
Yeah.
carnitine too. Like I see
Yeah.
so much carnitine deficiency when we're testing the metabolites in terms of that, ketone pathway. It's just fascinating for me when you see, clients after clients and you see these patterns and you can almost then become much more, well, you much better at your judgment and treatments because you're picking up on the patterns. Yeah,
Yeah.
it's
Yeah.
fascinating. All right, so we've talked about all of that. So what is next for metabolic psychiatry?
Yeah.
What are you most excited about at the moment? And I know you may have events that you're probably going to be doing. I know you've done one major event. So talk to us about what you've got coming up.
Well, yeah. So what's happening in metabolic psychiatry is really interesting. So, there's been, like I said, a bunch of pilot trials and large case series that have come out. But right now, there's been a whole round of funding of multiple randomized controlled trials to look
Mm,
at, look at this from a more, gold standard science kind of perspective. I mean, I sort of put that in air quotes a little bit
yeah.
because, we definitely can get lots of valid information from other sources than randomized controlled trials, but it does convince people. It does convince people in the medical establishment
Hmm.
the benefits. And so I'm really excited to see that research come out. There's studies in various disorders, like we talked about, the ones in anorexia, but
Hmm.
there's ones in schizophrenia, major depression, bipolar disorder. There's actually some trials going on in children as well with mental health issues. So in the next
Mm,
few years, we're going to see, all of that research data come out in journals. And I think we're going to see a huge amount of excitement about this field because those of us who are in it already know that this works really well. But we're going to
mm,
learn not just, we're going to learn a lot about the mechanisms because many of these trials also have basic science components with, functional imaging,
yeah.
neuroimaging. We've got metabolomics and proteomics and genomics data attached to a lot of these trials. And so we're going to really learn more about exactly the mechanisms and how to refine to do this easier and better for people. And so, it's something right now where anyone can access this, but I think it's going to become much more mainstream in the next few years, which I'm incredibly excited about.
Mm. And you're exactly right. It gives it more validity, but
Yeah,
by doing it in these pathways, and then it's a much faster way to get it straight into clinicians' hands to be able to then do the treatment and then make the difference. Yeah.
that's right.
Yeah. So, at the end of the show, we always ask sort of three rapid fire questions. So, one's
Sure.
personally applied to what we've been talking today, and then we've got two others that I'll ask as well. So,
Okay.
it doesn't have to be, complicated answers or anything. But
Yeah.
so, the first one for you is which biomarker do you believe that will become psychiatry's next vital sign?
Uh, it will be the beta hydroxybutyrate in the blood.
Okay,
Yeah.
there you go. Yeah, I sort of know that one was coming.
Yeah. Yeah.
And then the next one is top trick to live smarter, not harder.
Hmm. That's a good one. Um,
Yeah, yeah.
yeah,
Should
I
we?
mean, I think, you know, understanding and using the power of sunlight, you know,
Mm,
um,
so
sunlight
good.
is all around us and we don't make use of it. We don't allow ourselves to receive its benefits in
Mm-hmm.
our modern world, living
Mm-hmm.
indoors, and working indoors and not getting out. And that's a great way to, just, very easy, very accessible and pleasurable, and yet so beneficial. Yeah.
Yeah. And we are so scared of it. In
Yeah.
Australia, we are so fearful. Huge crisis of vitamin D deficiency.
Oh, we've done it. Yeah, we've done a great disservice with all this fear about melanoma and skin cancers from sun exposure. It's not that that isn't a real association in some people, but
Mhm.
it's much more complicated than the dermatologists would have us believe.
Absolutely.
Yeah.
So, and the final quick questions is your top tool, trick, or supplement for health?
Um, I would say, we already mentioned it, but
Mm,
creatine, I think
okay.
creatine is really beneficial for so many people. Um, and I guess the other one is a little bit of a trick, which is for people who aren't so sure about these metabolic changes, they're not sure if it's for them. I
Hmm.
really like the intervention of getting people to fast and
Hmm.
take MCT oil. And I've
Mm,
had tremendous success from so many skeptical people who come back and they weren't listening to what I was saying. They didn't care. And what they did hear of it, they said, "Well, what's gone wrong with this guy? What's he talking about?" And I tell them to just try that.
yes.
Get yourself up to fasting for 16 hours. Have some MCT oil when you wake up at hour 12, and just see how you feel. And
Mm,
they make ketones and they invariably come back and say, wow,
yeah.
now I'm interested in hearing what you have to say.
Yeah.
Because
Yeah.
they really feel what it's like. Now, you could do the same thing probably with exogenous ketone, but I still would, getting people the fasting and the MCT, I think is even a better approach if you can get them to do that because they feel like they did something. It wasn't just a chemical that did it to them.
Yeah.
Yeah.
Yeah. Yeah. You just can't knock it until you try it, can you?
Yeah. Right.
That was my first response when I actually tried a bulletproof coffee.
Right. Yeah.
And I was like, oh, whoa, this is my brain awake.
That's right. I had the same experience. I mean, I think almost everyone does. And
Yeah.
and so they really get a little taste of what, being in a ketotic state feels like from that. Not
Hmm.
the full version, but you get a little taste and you say, whoa, that's powerful. And then I just say, you haven't seen anything yet.
Exactly.
Be in ketosis for, a year and you just won't imagine how your body and
Potential.
brain will function. Yeah.
Wow. Oh,
Yeah.
it's so exciting.
Yeah.
I am just thrilled that this is making its way into psychiatry more and more. And
Yeah.
so where, Matt, can people find more about you? Your programs, where are you speaking next? Like where do they need to follow you?
Sure. So I'm on LinkedIn. I'm not on any other social media. I really am just sort of the mind that this is not so good for me. So, but
Yes.
people can
Yes.
find me on LinkedIn, and if they send me a message, I'd be happy to respond. I'd love to answer any questions or just say hi on LinkedIn. And then the program that I was describing is called Accord, spelled ACCORD, and people can find that. The website is accordmh.com.
Okay.
And so there's a wealth of information there about metabolic psychiatry. There's a whole, hour-long academic lecture I gave about metabolic psychiatry on there, and well as lots of other blog posts. We have our data to show about the kind of results that we're getting, and so
Hmm.
people can learn about it. And people have come from all over the world to come to our program because we're really the only ones who are doing this for this particular purpose, for people with
Mm,
serious mental health conditions. And we have that
mm.
expertise. We have the expertise about deprescribing properly and all of that. So people can think about whether this might be good for them or a loved one and contact us and consider maybe giving us a call. Yeah.
Yeah, absolutely incredible. So we'll be sure to include all of that in the notes section.
Yeah.
And this will come out on YouTube as well. And yeah, it's just been such a pleasure and connecting with you, Matt. It's I love this part of my job and just connecting with incredible people doing amazing work that I wouldn't find out about otherwise. So
Well,
thank
it's
you
really
so
wonderful
much.
to meet you and talk with you. And yeah, this was really enjoyable. And thank you for the work you're doing as well. Yeah.
No, absolutely. And yeah, I hope to be in touch very soon and I'll be following your work for sure.
Sounds good. Thank
All
you.
right. Thanks, Matt.